Hey everyone, and welcome. Today, we're diving into the architecture of something truly massive, healthcare in India. I mean, seriously, how do you even begin to build a system to care for over 1 billion people? Well, let's find out. I mean, just think about that for a second. That's not just a question, it's a monumental challenge. The sheer scale is almost impossible to wrap your head around. But India's approach is really fascinating. It's multi-layered, it's systemic, and that's exactly what we're going to break down today. So, here's how we're going to tackle this. We're going to build this system together, piece by piece. First, we'll lay the foundation. Then, we'll build up the safety net. After that, we'll fire up the engine that powers it all. And finally, we'll see how it's expanding its reach. Ready? Let's get started.
All right, first things first, the foundation. You know, just like any skyscraper or massive bridge, you can't build a national healthcare system without a rock-solid plan and the right materials to make it happen.
And for India, it all starts with the blueprint, the National Health Policy. Think of this as the master plan. It sets this huge vision for universal health coverage. But, and this is super important, it puts a critical focus on strengthening care right at the grassroots level. It's really the North Star guiding the entire system.
So if the policy is the blueprint, these are the actual bricks and mortar of the system. It's all organized in this tiered structure, which is pretty clever. Down at the base, you have primary health centers, giving people in rural areas their first point of access. These then connect up to community health centers, which act as local hubs. And then, at the very top, you've got these incredible centers of excellence, like the All India Institutes of Medical Sciences, or AIIMS as you probably know them, for the really specialized care.
Okay, let's move on to the next layer. We've got the foundation in place, right? So the next logical step is to build a really strong safety net around it. And this net is designed to protect every single citizen, not just from getting sick, but from the financial nightmare that can come along with it.
And this really gets to the heart of the mission. Let's be honest, one of the biggest challenges in healthcare anywhere in the world is just affording it. So a central goal of this safety net is to slash those out-of-pocket expenses. The idea is to make sure that a medical emergency doesn't turn into a total financial catastrophe for a family. Now, this safety net has two key parts. On one side, you've got financial protection. This is driven by massive schemes like Ayushman Bharat, which is, by the way, the world's largest government-funded health insurance program, covering over 500 million people. That's huge! Then, on the other side, you've got preventive care, which is all about stopping illness before it even starts. It's like having a fence at the top of the cliff, not just an ambulance at the bottom.
And this preventative effort is incredibly comprehensive. We're talking about huge national immunization programs, the Poshan Abhiyan mission to fight malnutrition, the Swachh Bharat or Clean India mission to dramatically improve sanitation, plus all sorts of targeted initiatives for mothers and children. It's a massive public health push.
Okay, so we've got our foundation and our safety net. But what actually powers this massive structure? Let's head down to the engine room and look at the dynamic systems that are driving innovation, efficiency, and quality across the entire system. It really comes down to three key drivers that are powering this engine. First, there's this incredible digital and telemedicine transformation happening. Second, you have India's role as a powerhouse in pharmaceuticals and research. And third, a deep commitment to excellence in medical education to keep training the next generation of healthcare leaders. And here's a perfect example of that digital transformation in action, eSanjeevani. This is a national teleconsultation platform that has already handled millions of consultations. What it does is basically dissolve distance. It means a patient in a tiny, remote village can connect with a top specialist in a major city. I mean, that is an absolute game changer for accessibility. You've probably heard this phrase before, and it really says it all: the pharmacy of the world. India's pharmaceutical industry is a global giant. We're talking about producing something like 60% of the world's vaccines and 20% of its generic medicines. This industrial strength doesn't just serve its own people. It's absolutely critical for global health, making life-saving medicines affordable for everyone, everywhere.
Of course, a world-class system needs world-class people, right? And that's where premier institutions like AIIMS come in. They are the bedrock of medical education in the country. But they don't just train doctors. They're the ones setting the national standards for clinical practice and for cutting-edge research. They're training the leaders of tomorrow. All right, we're at our final layer. Let's look at the systems that expand the reach of healthcare, both by looking inward to traditional practices and by looking outward to the global community. This is about going beyond the conventional.
And this is a really unique aspect of India's system, the formal integration of traditional medicine. There's a whole ministry for it, the Ministry of AYUSH.
It promotes systems like Ayurveda and yoga not as some fringe alternative, but as complementary practices that are integrated right alongside modern healthcare. The goal is to offer more holistic options for wellness. Expanding the reach also means being ready for anything. Nationally, that includes robust emergency response systems, like the National Disaster Management Authority and the 108 ambulance services. And globally, it means actively collaborating with organizations like the WHO, which really solidifies India's role as a major player in international health.
And there you have it, the complete picture. When you put all those layers together, the policy foundation, the physical infrastructure, the financial and preventative safety nets, the powerful engines of digital, pharma, and education, and finally, that expanded traditional and global reach, you see this incredibly comprehensive healthcare architecture. It's designed for both resilience and, really importantly, inclusivity.
So that brings us to our final question. This isn't a static system, right? It's a living, breathing, evolving thing. The sheer scale of this transformation, blending cutting-edge digital innovation with massive industrial might, is pretty much unprecedented. So as these systems continue to mature, you have to wonder, what new standards will they set for the future of global health?